Assalamu alaikum. This is a male patient aged 50 years old and complains of persistent vomiting. At the description of the video you will find two links, one for the DICOM files and the other one for the case report. So I advise you to test yourself by viewing the DICOM file before you resume watching this video. First we did the CT abdomen with IV contrast. We used the non-contrast phase, arterial, followed by venous phase. Then we asked the patient to drink diluted contrast or contrast, thick contrast, to assess if the contrast will pass from the stomach or not. Because, as you can see here in this case, there is markedly distended stomach, and you should be familiar with the normal size and normal appearance of the gastric volume. In this case, the body and the fundus, as well as the pylorus, all parts of the stomach are usually distended, and you should look for the cause, which could be a malignant lesion or a benign structure. Mostly, if it was a benign structure, it will be at the pylorus or the first or second part of the duodenum, sequel to a peptic ulcer, healed peptic ulcer by structure, or it could be a malignant lesion at any part of the stomach, but the sites which cause gastric distension are the gastric pylorus and the gastric outlet, causing gastric outlet malignant occlusion or occlusion. تمام. So by checking the arterial phase, we are looking at the gastric wall and the gastric mucosa, searching for any enhancing lesions. Actually, we did not find those hyper intense foci are food particles inside the lumen, not a mural enhancement. And you can check the non-contrast phase, you will find those scattered hyper dense materials. Mostly again it could be a rice rosy يعني. تمام. Then recheck the venous phase. As you can see here, there is no mural thickening, but there is a stricture or narrow focal narrowing between the pylorus and the first part of the duodenum. We ask the patient to drink diluted contrast. The contrast won't pass from the stomach to the duodenum, still retained, and the stomach is still distended. No contrast passed through the duodenum to the jejunum. After 15 minutes, we repeated again, imaging the stomach to assess any passage of contrast, which confirmed that there is a true luminal compromise here as the gastric outlet, mostly sequel to a stricture, because we don't see a mural thickened and a mural soft tissue lesion. The patient did an endoscopy and took a biopsy, and the result was a benign findings. There was no malignant cells, which confirms the presence of stricture. As regards the management, we lost the patient, and we didn't know what the surgeon did with him. So to report this case, you will mention the technique with oral gastrography or oral positive contrast. Gastrography مثلا. Okay. The stomach is hugely distended with marked focal narrowing at the junction between the first and second part of the duodenum, or the junction between the pylorus and the first part of the duodenum حسب ما انت تبقى شايف. No sizable soft tissue lesion. دي مهمة ان انت تبقى قايلها في الريبورت بتاعك. No sizable soft tissue lesion. the nature of narrowing can't be fully assessed on CT. ده نقطة ميديكوليجال محتاج ان انت تقولها. وارد تبقى في concentric annular neoplastic lesion وانت مش شايفها كويس، فانت بس بتحط النقطة دي كنقطة يعني ميديكوليجال. So the possibility include being fibrotic structure versus malignant annular lesion for endoscopic assessment and histopathological correlation. انت لما بتكتب يعني مهم ان انت تحط البوسيبيليتيز وتحطها بالترتيب اللي هو المناسب. الغرض كله ميديكوليجاليتيز. قاعدة عامة، هو محدش هيسقف لك لما تعمل حاجات صح كتير، لكن كله هيعمل لك المشانق لما انت تعمل غلطة. فانت لو يعني احنا في الكيس دي احنا ماشيين ناحية ان هي فابريتك ستراكشر، ولكن وارد في possibility ان تبقى مالجنت. فانت لو ما كتبتش ان هي فيها possibility ان تبقى مالجنت، الموضوع ده هيعمل لك مشاكل كتير. وبالاخص برضو ان لازم الاهل يبقى عندهم، او المريض بمعنى صح عنده استعداد ان البوسيبيليتي دي موجوده. يعني ما ينفعش تطمنه قوي ففي الاخر يرجع في مالجنس، لا انت تحط الامور في نصابها. موستلي فايبروتيك ستراكشر، بس ما نقدرش نستبعد، لازم ناخد عينه ونحللها. تمام. اتمنى تبقى الحاله يعني كانت مفيده، وإن شاء الله نلقاكم في حالة أخرى. إلى اللقاء.